Cataracts.
Like lied about it.
She said I looked so loud.
Yeah, I know, you do.
All right, cataracts. Opacity of the lens. This is the one where they have like, we start seeing like that little white duskiness come over their eye, okay? So, risk factors are advanced age, diabetes, heredity, smoking, eye trauma, because it can happen from trauma too, excessive exposure to the sun, corticosteroids, beta blocker use, decreased visual acuity, blurred vision, double vision, which is known as diplopia, and it is a progressive, so continue, loss of vision, the visible opacity, that's like that little cloudiness over their eye, and absent red reflex, which is, have you seen when the light shines in your eye? Or especially when a doctor, like an optometrist, like does an eye exam, they see this glimmer when they shine certain lights in your eye, that won't be there for you. Okay, so cataracts, opacity of the lens will begin to impair vision. So usually it happens because of age, the lens is drying and this causes these fibers to continue to compact. So I cannot stress this enough. The biggest emphasis in order to prevent this, and again, assuming that it's not hereditary for you or like, you know, family history and all this, the best thing that you can do that is modifiable is wear sunglasses. Protect your eyes from the sun. Now, while we all, and I think I've pointed this out to y'all, right? While we all believe that like these like colored eyes, like, and it's so beautiful and that's what you want and this, it is the weak eye. Okay, they're very sensitive to light, they're more likely to require glasses, they're more likely to go blind, they're more likely to develop cancer, they're more likely to do everything, like it's a weak trait. Hence, it's not easily passed on because by natural selection you want to consider what usually goes down. The stronger gene. So the idea of light-haired, light eyes, like being light-colored, doesn't really favor in nature. Okay, it favors when you're in buildings all day, I guess, but by nature's force, it's not great. So the darker your eye, the more resistant you are to the sun, just like with your skin as well.
But I get prescription.
For what?
I
I never have woken up and thought to myself, you know what I really wish right now? I wish I could get a prescription for tits.
I've never been pulled over for the most. I was pulled over many people.
Alright, other risk factors. Other risk factors. Advanced age, diabetes is a big one. Heredity, smoking, trauma, again, exposure to the sun. Corticosteroids, beta blockers. Now what will they see? Decreased visual acuity. That means how well they can see. They'll have like this blurred vision, okay? They start slowly because it's a blindness, double vision. And again, the hallmark for this is these three right here at the bottom. Progressive loss of vision, it's getting worse. Visible opacity, you're gonna see this like little like film over their eye. It's like a little white film that's just developing over the lens, okay? And they'll have an absent red reflex. These three are the ones that are pretty unique, to especially these two, because obviously all of them lead to loss of vision. But these two are the ones that are more specific to cataracts. Absent red reflex and the visible opacity, that little white lens that's forming over.
I thought some people only get like some of those stuff like in one eye, but not.
Yeah, you go. I'm glad you passed, bro.
Already working.
You guys can do it, like him.
Trust the
He's trying to
process.
be like me, look at his uniform.
Trust the
He's like,
process.
Mr. Armando's wearing black, I'm gonna wear black today. They said, how much are you making?
I just started. This is my first day today. You could get paid up to $50 an hour as an LV.
Oh.
If you do home health.
Oh.
What's your uncle?
Yes.
With your uncle?
Which I'm starting today.
Are you Armenian?
Yes.
Yeah.
You guys got this. The Anglex is way easier. Yeah. You guys all got this.
Alright, thank you.
Bye, guys.
Alright, so. No, him I definitely know. Did out a lot. Alright, so, client education, or sorry, nursing care, under patient-centered care. So what we do? Check visual acuity. What do we use for visual acuity? Use a Snellen chart. See how well they can see, monitor their vision. Okay? Determine the client's functional capacity. Increase light in a room so that they can see better. Okay? Provide adaptive devices like magnifying glass. Large print. You guys know what this means?
Big word.
You're man right.
No.
Large font.
Large font is a more appropriate way to describe it. See, this is a big word. Okay? I don't know if you can pronounce it or sound it out. But this is big font, you see? So you wanna do this? Big word, big font.
Complete.
So, large print for books, newspaper, and then talking devices like your cool new iPhones. So that it tells them the time, they can just be like, Siri, what's the time? Did I tell you guys about my old lady who thought she had an iPhone and it was a flip phone? I guess I didn't. Okay. Therapeutic procedure. This is the one where you could get surgical removal of the lens. Now, things to know about this, what I mainly need you to do is focus on what do the client do and what do we do, okay? So we monitor for intraocular pressure, bleeding, pain relief. But look at the client education is the bigger one to like really understand. So one, after the surgery, they have to wear sunglasses. Okay? And report infection. So what are they gonna see coming out of their eye? Yellow-green drainage. And then there's certain actions like the following. Look at this, activities, avoid activities that increase IOP. And I want you to highlight them and you can go over them. Bending over at the waist, sneezing, blowing your nose, coughing, straining, head hyperflexion, restrictive clothing like tight shirt collars and sexual intercourse. All of that has to be limited. Okay? This one right here, you'll see it right above on page 88. The client education, it shows what they cannot do. Now, what they could limit, meaning very minimally or should avoid, is tilting the head back to wash their hair. That's a big one that I've seen come up. Tilt, head back, or hair wash. You want to limit that or avoid it if possible. No. Okay? Cooking and housekeeping. You don't need to do that.
How does cooking increase it?
I don't know. I'll be honest. You leaned over. No cooking, housekeeping, no rapid jerky movements. Now I will say this, if you see these answers, that's the answer. Rapid jerky movements like this.
Or vacuuming.
Yeah, no vacuuming. No sports. Heavy machinery. You want to avoid this. I think with cooking it means like.
You can't see, why are you cooking?
Not like. Not like they're boiling an egg, you know?
I'm sure they can make cereal.
Yeah, that's right. Okay. Are we good? Now, report pain, and here's the thing to go. Best vision is not expected until 4 to 6 weeks following surgery. Okay. Report any lid swelling, decreased vision, bleeding, discharge, pain, flashes of light. This is all something you should report to your doctor. So another question I was going to point out, the 4 to 6 weeks is because some of the questions are like, right, what indicates the patient teaching and that they say things like, oh, my vision will be great right away. Like, it's not like that. It takes weeks for it to like adjust and become normal and have good vision. I meant to put discharge, I think. Oh, decreased vision. I put decreased bleeding. Decreased vision. So if their vision is going more away, I didn't write vision. But yeah, you report bleeding as well. Not decreased bleeding, but bleeding. Pain and flashes of light. Flashes. It's in your butt. Like, that's how you can follow along. Write your notes. I try to write down the key points so you know that that's what you focus on. Last one, glaucoma. And you have open angle and closed angle. Now, open angle is the more common. Okay? And the outflow is decreased of the aqueous humor, which means like the fluid within the eye. So hence, it starts to like hurt. This is a gradual rise in the pressure inside the eye. Essentially here, okay, you have fluid in your eye that cycles in and out. Now the glaucoma is when part of that canal will close. But in open angle, it's still open, but it's decreased. Now in closed angle, the difference is that the pressure will rise suddenly, okay? And this one it is, IOP rises suddenly, increase intraocular pressure, okay? This causes sudden and severe pain. Okay, requires immediate treatment. Immediate treatment. So risk factors are age, infection, hypertension, diabetes, mellitus, genetics, of course. Expected findings, you can have a headache or open angle, they vary a little bit. Okay, mild pain, loss of not central, but the key one for here is peripheral vision, meaning your side vision. This is the one with halos around light. IOP is now greater, more than 20. This is what's saying is rapid, decreased or blurred vision. Halos. IOP is greater than 30. So a lot more pressure, hence a lot more painful. Ready. Almost. Let's go over the medication and the surgery. Medication. I need you to know how to administer it. Okay? Medication is given every 12 hours. Okay, instill 1 drop in the eye twice daily. Now that's just to be different on your thing, but usually it's 1 drop in each eye. 1 drop, each eye. Now, most importantly, is that if you have more than 1 medication, you have to wait 5 to 10 minutes in between each medication. Do not touch the tip of the application of the med to the eye. Don't touch the eye. Have hygiene. And then don't forget pressure on that inner corner of the eye. Alright, so you guys know how to put eye drops, right? Lower down, put it in the eyelid, and then you put pressure here on this lacrimal duct right here. Okay, so it doesn't get absorbed systemically. Stays in the eye. Wait 5 to 10 minutes in between each medication. I had a dude that had 2 drops, I think 3, and he would count the 5 minutes. He would count to 300, and then I could do the next eye drop. So I used to just wait, or if I was really busy, I'd be like, I'll be right back. And you finish counting, okay? He'd be like, okay, like, I'm like, do you mind if I gotta go somewhere, okay, I'll be right back. He's like, okay, go stay counting. Then you know it was over 300 seconds. Yeah.
I mean, I know it's pure HI, but do you think it really matters? And like,
Just because you don't want to mix it. It should absorb one before the other. Just like taking all your meds at once is not exactly the most beneficial thing either, but I don't think anybody wants to sit around and give like different medications like 10, 15 minutes apart to allow them to absorb differently. But it's not great to drink them all at the same time, at least some. Some you can mix. Like if you're doing vitamins, stool softeners, that's fine. But like especially like anti-epileptic medications, hypertension medications, antibiotics, you honestly you don't want to mix them. But I mean we do, or we just take them all at the same time. It's not optimal. Okay. So for this one, don't forget that one of the medications that you can also give is mannitol. Because mannitol draws fluid from the brain and eyes, okay, to reduce pressure. Do we remember how to give mannitol? Filter needle or a filter line, okay? And watch out for fluid overload or symptoms of heart failure. Now, for the glaucoma surgery, it's very similar. I'll go back to it right now. For the glaucoma surgery, very similar, right? They're gonna wear sunglasses, they're one of the biggest, to protect them, report infection, avoid activities that increase IOP, which again, sneezing, coughing, straining, sex, okay? Another big one is do not lie on the operative side. This is probably one of the key instructions for this disorder and surgery. Okay? Report any vision changes, floating shapes.
Floating eyes.
And again, limit activities. We said right here, right? Limit activities like tilting head back, again, cooking, housekeeping, driving, rapid movements. And you want to take it easy for the good. And again, best results in
4 to 6 weeks.
4 to 6 weeks. Yeah, they shouldn't do this, like, I'm washing their hair. You know, I pointed that out and I discovered when I said that, why would people do that? How many people do that? And I don't. Forward.
What? Get the water all in your eyes.
Your eye,
I think
close your
this
eyes.
is the girl thing.
It's the length of hair. It's the length of hair.
It's a girl thing, 'cause you have bangs, so you go back.